Okay, so I am here today to talk to you about Sever's disease. This is a condition that happens in adolescence, typically before the growth plate closes in the foot. Um, Sever's disease is kind of known as posterior heel pain, specifically in adolescence. It occurs mainly on the calcaneus, kind of at the Achilles tendon insert. Um, It is brought on by overuse, which can be like overpronation of the foot, tightness of like the plantar fascia, or like the Achilles tendon or calf muscles can also cause this to start acting up. Um, Weak dorsiflexors can also attribute to this disease. Running on hard surfaces with like improper footwear. So like if you were to run barefoot a lot on like concrete, like as some kids do, that can also make this condition appear in some kids. So, like I said before, this occurs during the years of skeletal development, before the calcaneal apophysis closes. So, between like ages 15 to 17 is when the growth plate starts to disappear. So, typically after that age, you won't see this happen. So, like anywhere between like 13 to 15 is when it's really apparent, based on the articles I've kind of read. So some key tests and measures for this disease is the squeeze test. It's a little bit different than the squeeze test that is testing for like Achilles tendon rupture. It's manual like compression on the medial and the lateral malleoli of the heel, and then like just squeezing your hands together in like a compression type of way that will typically cause pain or like the reproduction of symptoms. MRI is used best to rule out other conditions at the heel, like if there was any ankle sprain that is for some reason causing heel pain. Um, the main interventions that are provided in physical therapy are stretching. So like stretching those calf muscles that are tight or the plantar fascia, um, or just strengthening the weak dorsiflexors. Um, but a lot of times you have to just rest. It's mainly an overuse thing that shows up in kids, and it's just some random heel pain because of that growth plate in there. In some severe cases, you can see a limping gait because they don't want to put weight on that heel. So if that's the case and like rest isn't really helping and they're still having some severe limping, like a cast that requires like immobilization or like a walking boot with crutches is something that can help the patient like take some of that weight off of that limb for the time being, because eventually the pain should dissipate as the rest continues. Um, so this is an MRI here of Sever's disease. So you can kind of see along here, along the back of the calcaneus, there is a little bit of a glow that kind of just shows the disease right there. So it can look different in different patients depending on the severity, like how much edema or fluid is in that space, and also how big the growth plate is left, like how much is left before it closes too, um, can also determine how significant the disease is in each individual patient. So yeah, major takeaways is if they fall in the age group, they have some pain on the heel. It could definitely be Sever's disease. It's pretty common. It's an overuse injury. There's really no surgery or surgical interventions. So yeah, but it's just good to be aware of, especially if you're treating like pediatric patients.